And this big one that's coming into the top of the heart here, this is the superior vena cava, okay? And it branches, dumping into it. You have the right brachiocephalic vein and the left brachiocephalic vein. And think of the name brachiocephalic. It supplies blood to the arm, brachii, and head cephalic, okay? So if it's a right brachiocephalic, it's the right arm and the right side of the head. Left brachiocephalic, left arm and left side of the head. So from the brachiocephalic, you get this branching, another sort of Y-shaped branching. You have this piece that goes off to the left arm. So from here to about here, this is the left subclavian vein. And these subclavians, when the cat's actually, walking around being a cat, this subclavian vein is actually inside the chest cavity. Okay. But when we dissect them, we cut away part of the rib cage and we pull it out and we stretch it out so it actually kind of comes outside. Okay. But this is the left subclavian. And then in his armpit region here, from about here to here, see Caroline? Yeah. This right here is the left axillary vein. So think of like your Axe deodorant. You put it in your armpit. Your axillary vein is in your armpit. Okay, if that helps you remember, go for it. Then when you get out to the arm, this is the left brachial vein. Okay, so subclavian in the chest cavity, axillary in the armpit, brachial in the arm. Okay. Now, not only do you have the branch that goes off to the arm, but you have the branches that go off to the head. It's actually dissected a little better on the right side, so we'll look at this one first. So you can see this guy where it starts to come up towards his head. This is the right external jugulars vein. Okay. And then coming off, you see this other Y. This Y that comes back, it actually wraps all the way around his shoulder. That is the right transverse scapular vein. So think of like scapular, like shoulder blade. This transverse scapular wraps around to his shoulder blade. That's it for the veins. The veins are pretty simple. Now the arteries, I have to do all these contortions with my hand to open it up so you guys can see it sometimes. So I'll try to do my best. But this vessel that comes right out of the top of the heart, it's this little bump right here. Kind of looks like a little pyramid shape. This right here is the aortic arch. It actually sort of wraps a little bit around this way. Aortic arch. So if I were to pin it, I'd pin it right at the top of the heart. Okay. Now from there, you have this vessel that comes out of the top of the heart. This first one that comes off the aortic arch. This right here is the brachiocephalic artery. So you remember with the veins, you have a right and a left brachiocephalic. Okay, with the arteries, you just have the one brachiocephalic. Comes straight out of the top of the heart. Now the next one that comes off the aortic arch, you see this guy right here. It runs from the aortic arch up to about here, where this rib cage ends. This is the left subclavian artery. Sorry. My hair is just at the length now where it hits right there in that crease and it makes me itch. Thanks. Okay. And then last but not least, you can't really pin this guy without, because I would have to basically take out the heart and take out the lungs to show it. But it wraps back around behind the heart. That's the thoracic aorta. I'm not going to pin it on the test. Okay. So now let's look at what come off of these brachiocephalic arteries and subclavian, left subclavian. Okay. So when I scoot the veins around here, you can see there are three branches that come off the brachiocephalic. You can see one here, and the one here. I don't know if I can show it any better at this angle. But one here, and one here. Okay. The one that comes off toward the arm, right here, this would be the right subclavian artery. So your left subclavian artery comes directly off the aortic arch. The right subclavian artery comes off the brachiocephalic. So the right subclavian artery, it's only this long. The left subclavian, on the other hand, is about 3 times as long, comes directly off the aortic arch. Okay. So right subclavian, and then you would have axillary and brachial, but they're not dissected. Okay. So the middle one that comes off the aortic, the brachiocephalic, this one right here. This one comes up the right side of the trachea. This is the right common carotid artery. Okay. And then the last one comes off right here. See right here? Comes up the left side of the trachea. This is the left common carotid artery. Left common carotid artery. Okay. Now let's follow this left subclavian. Sorry, left subclavian. It comes up and it ends right around where the rib cage ends, like right in there. So like I said, you fold up the arm, you could kind of imagine. The left axillary artery just like your Axe deodorant, you put it in your armpit, left axillary artery, and then left brachial when you get out to the arm. Okay, so that's it for the upper on the cat. So now let's look at the lower. The lower is a little easier in some ways because things are a little bigger, but you get into kind of a jumble when you get down here. Okay, so let's first talk about the inferior vena cava. You see this large, big vessel running parallel to the spine. That's the inferior vena cava. Okay, so coming off of it to the top of the kidney, this right here is the adrenal lumbar vein. And think of your adrenal glands on the top of your kidney. Adrenal lumbar goes to the top of the kidney. Next, you have the one that goes directly to the kidney. This is the renal vein. So the renal vein. And then as we go down, you get to the point where the inferior vena cava ends, and it forms this Y shape. It's very hard for me to get in here and show it. So that's a pretty good indication. I'm not going to be able to pin this part on the test. Okay, but you get the left and the right arm of the vein, of the Y. The one to the left right here, just this little piece, is the common iliac vein. Okay, and right where it comes off, this guy right here, this is the left internal iliac vein. Okay, so common iliac vein, internal iliac vein. So left common iliac vein, left internal iliac vein. And then where it continues down the rest of the way to where the leg bends, this piece right here, this one's pretty easy to point out actually, from here to here, from where the tip of my thumb to the tip of my pointer. This is the left external iliac vein. When it continues down the rest of the leg, that would be the left femoral vein. And it's the same thing here with the really short, on the right-hand side. You have the short common iliac vein, the short right internal iliac vein, and then the larger right external iliac vein. Okay, but now we'll look at the arteries. These are pretty easy. Okay, so this large vessel that also runs parallel to the spine, just like the inferior vena cava, this guy right here is the abdominal aorta. And you have several vessels coming off that we have to know. You can see this sort of V shape right here. The top part is the celiac trunk going to the stomach. The bottom part here is the superior mesenteric going to the large intestine. And then you shimmy all the way down here. This one going to the that's the small intestine. This one here coming to the large intestine is the inferior mesenteric. So let me break them down again. Celiac trunk goes to the stomach, because your stomach's at the top, right? And superior mesenteric goes to the small intestine, just below the left stomach. And then the inferior mesenteric goes to the large intestine, which is the bottom. Okay. But right here, you can see this guy coming into the kidney. That's the renal artery. So renal artery, and then we already did the renal vein. Okay. So now we get down to the bottom, and it's actually much easier to see this as compared to the iliacs of the veins. Okay. Let me clean it up even more if I can. So we have these right here, and these are the left external iliac artery and the right external iliac artery. So think of this as like a little bird's foot with like several toes. Okay. The toes to the outside would be like his pinky toe and his big toe, right? Be left external iliac artery and right external iliac artery. Now here, there's this little tiny piece in the center where before we get this branch here. This right here, a tiny little piece, is the internal iliac artery. And then it branches into the left internal iliac artery and the right internal iliac artery. So let's follow this left external iliac artery down, move her uterus over a little bit there. So this left external iliac artery all the way to here, to where the leg bends. Okay, and then from here on down is the left femoral artery. So it runs along the femur. That's it.